After that, you would say, I would like to go for oropharyngeal or nasopharyngeal airway. Done. So this is part A, and there are only two ways. Where are the differences? There is another two differences. Anyone want to tell? Thank you very much, Hina. In part A, there is another two differences. For example, you are going to see a COPD patient. What mask you're going to use it? If you are going to see a COPD patient, okay. In part A, COPD, what is the difference? Guys, write in the chat.
24, 26.
Excellent, Allah. Venturi mask. So we are going to do the Venturi mask. If the patient is having COPD, you are going to use a Venturi mask. Okay. And how much target oxygen? 24 to 28. You have to verbalize it. And sorry, how much oxygen? 24 to 28%. And your target is range is 88 to 92%. Okay. Will you remember that? If the patient is in the part A, vomiting, if the patient is vomiting, what you will do?
Nasal cannula.
Nasal cannula. Vomiting. If patient is vomiting, you will go for the nasal cannula. Okay. So there are 3 to 4 different possibilities of patient you're going to see. Patient is not talking. Okay. When the patient is not talking, you will give, thank you very much, and leave. When the patient is not talking, what you will do, you will assess further airway, give oropharyngeal, nasopharyngeal. Patient is talking. If saturation is low, go for it. Low saturation, COPD, Venturi. If patient is vomiting, the nasal cannula. This is part A. Okay.
Will we insert all these devices in reality?
Yes, you have to do it in reality. When you will be in academy, you will able to see that. When you will be in academy, you will practice. The people who are here, they do practice. It's just a quick revision for all of you. And basically, in the reality, you would be able to practice those things. All right. Okay. So this is part A. Part A.
In the COPD, we will start with the Venturi from the start, or no high flow oxygen, and then when the
No. From the start. From the start, you can start. No problem.
Okay.
From the start, you can start. Okay. Thank you very much for asking that question. So that was the part A. Okay, you'll that for the Simman. Okay, so we are on the Simman now. So we are going to go on the part B. Let's say we are going to these like let's see, we are going to do the shortness of breath Simman first. Okay. So first of all, we are going to do the shortness of breath Simman, and I just going to give you information about that, and you will be able to reflect back if you are going to have the shortness of breath Simman, how you are going to do. So I'm going to go on the B part now. Okay, you ready? So in the A part, I'm going to repeat quickly, mouth monitor. This is what you need to do, mouth and monitor. Okay. In the part B now, so it's the breathing part. I'm on the part breathing. So what you need to tell the patient when you go into the part B. So when you go into the part B, what you will need to tell the patient that, okay, Michael, I've given you oxygen. I'm just going to assess you further. I'm going to examine your chest. So you will say, look, listen, and feel. I'm going to give you finding for all of the Plab 2 scenarios. Look, listen, feel. Anyone tell me what finding you will have on looking at the patient? When you are going to look at the patient's chest. For example, breathing is related to the chest. When you're looking at the chest, what are you looking at and what findings you will get? I will write only findings in Plab 2. When you're looking at patient chest, okay, when you are looking at the patient's chest, what findings you might?
Rash and barrel-shaped chest in COPD.
Symmetry.
Okay. So in the Plab 2, you will have only rash. You will see only rash. They will put a sticker. So in whole of the Plab 2, you will have only rash, and that is anaphylaxis reaction. Okay, that is anaphylaxis reaction. Thank you very much, Hannah. So when you will see rash, what you will do, and let's say it is anaphylaxis scenario, you started from the part A. In the part A, you saw that blood transfusion is going on, and when the blood transfusion is going on, you have a bit of idea the patient might have. So let me give you a scenario for the anaphylaxis. Anaphylaxis scenario, you will get a scenario in which they will tell you that you are going to see a patient who came after after appendectomy. The blood transfusion is going on. You will enter into the cubicle. You're seeing the blood transfusion is going. You done part A. In the part A, what you have done, you give an oxygen mask. You give an oxygen mask. You saw the saturation was low. You assess the airway, and there was no swelling, nothing. When you start your B examination, okay, Michael, at this point, I would like to have a look of your chest. I'm going to have a look, feel, and listen to your chest. Look, feel, listen, or tap of your chest. At this point, I'm going to see your trachea. I'm going to assess your trachea. Chaperone will be with me. I'm going to see your trachea. You will not get any finding. When you will get one finding here, that is a rash. When you see a rash, stop everything. Stop everything, okay? When you see a rash, you need to stop everything, okay? And you will say what you will verbalize. I'm going to, Michael, I'm suspecting anaphylaxis. What I'm going to do now, I'm going to give you, what I'm going to give now? Adrenaline. How much? 0.5 mil, 1 in 2,
1 in 1,000.
1 in 1,000. That's it. This is you need to say. Congratulations, you done, you manage anaphylaxis. So you are going to manage anaphylaxis even in the start when you are going to see the patient is going to have a rash. Now, you're given adrenaline, literally you go to the go to the trolley box, got that, and after that you're given the adrenaline, and you will say ideally, I will repeat that adrenaline. You will say ideally, I will repeat it and reassess you, but you will continue your chest examination. You'll continue your chest examination. So how would you continue your chest examination? What you are looking at, you're looking at the chest movement, you're looking at the trachea, but you will never forget in the part B, I'm going to give you mnemonic, that is chest and chest x-ray. So you are going to see the chest auscultation. That means chest auscultation. And the second part you are going to do in there is chest x-ray. So these two things you will never forget. Why I'm going to tell you? Because chest auscultation in Plab 2 will give you findings. What would be the finding in chest auscultation, Hina?
Crepitation.
We crack,
Crackle, crepitation,
crackles, and what else?
crepitation.
Crepitations. It could be, okay, that can come with that, but apart from that, any other finding you get on the chest. So the top finding is a wheeze and crackles or craps that can be, and on the x-ray, will you get any finding?
Cardiomegaly and hyperinflated lung fields.
So you might have a heart failure picture in the cardiomegaly, okay. These are the findings you might have in the in the chest when you are going to do the chest x-ray. So these are the findings. Okay, guys, tell me wheeze. In which scenarios you will have wheeze?
Asthma.
There are three scenarios: asthma, COPD, and anaphylaxis. So whenever you have a wheeze, so these are the three scenarios in a Plab 2, and how you are going to treat wheeze. How you are going to treat wheeze.